But let me thank everybody for being here. I'm very pleased to be here with Senator Ginny Lyons, Chair of the Vermont Senate Committee on Health and Welfare, as well as Representative Alyssa Black, Chair of the Vermont House Committee on Health Care. Also with us today are Owen Foster, Chair of the Green Mountain Care Board, which regulates hospital budgets and health insurer premiums. Lisa Ventris, Co-Chair of the Vermont Healthcare 911, a coalition working to lower costs and improve the quality of healthcare access across the state. Mike Fisher, the state's healthcare advocate, and Jacob Berkowitz, a representative from UVM staff union. Everyone knows that our healthcare system nationally and in the state of Vermont is broken, it is dysfunctional, and it is wildly expensive. Nationally, the cost of health care per person, unbelievably, is $14,500 per person. In Vermont, it is even higher than that. This outrageously expensive health care is economically unsustainable, and by the way, twice as much per capita as other major countries spend, which in fact guarantee health care to all of their people. Now, despite that huge expenditure here in Vermont, many of our people are either uninsured or underinsured with high deductibles and co-payments. Further, we don't have enough doctors, we don't have enough nurses, we don't have enough dentists, we don't have enough mental health care providers or pharmacists. And in one of the oldest states in the country, our home health care programs and nursing homes are under enormous stress. And right now, as part of Vermont's health care crisis, Blue Cross Blue Shield of Vermont has requested another massive premium hike for Vermonters, 23.2% for people who buy their own health insurance. And I'm not sure how anybody is going to be able to afford that. Over the last 4 years, Blue Cross Blue Shield has lost over $150 million, and they're now on the brink of financial collapse, despite requesting premium increases of over 20% year after year just to stay afloat. The bottom line of everything I'm saying, and I think those who follow me will say, is the status quo is unacceptable. We cannot continue to ignore this crisis. In Washington, under Trump and the Republican leadership, we're moving in the wrong way. Here in Vermont, I'm proud to say that there are important initiatives trying to begin to address this crisis. And by the way, what's going on in Washington, when we talk about $715 billion cuts in Medicaid, don't think that that only is going to impact individuals. It will. Between 8 and 13 million people throughout the country are going to lose their health insurance. It will also impact nursing homes and community health centers and hospitals as well. Now, members of the legislature, the chairs of the Senate and House health committees will be discussing the legislation that they are bringing forth. But let me just say a few words, in my own view, of some of the areas that we've got to address in the years to come. We must invest more in primary health care. Why is that? Because when people are able to get into a doctor's office when they need to, they end up becoming less sick. They don't have to end up in an emergency room or in the hospital at great cost. Keeping people healthy is the right thing to do. It saves money. As a nation, we spend far less per capita than other countries do on primary health care. We have in Vermont a massive nursing shortage. Last year, in Vermont, we spent over $75 million on traveling nurses who are paid substantially more than local nurses. That is crazy. Being a nurse is an important, good job. We should expand our nurse education programs to get more people graduating nursing school so they can work in the state of Vermont. When we do that, we save money. We need to significantly improve and increase our home health care workforce. There are thousands of Vermonters who would prefer to stay in their homes rather than go into a nursing home. But we don't have the workforce to take care of these people, elderly and disabled people, in their homes. That is, again, unfair to those families, and it is also extremely expensive because nursing home care is much more expensive than home health care. But then when we talk about even our nursing homes, you got another disaster right there in recent years. Again, despite being one of the oldest states in the country, dozens of nursing homes have shut down, and they are wildly expensive. So we got to address that as well. Everyone is aware that when we walk into a drugstore, walk into a pharmacy, the cost of prescription drugs are very, very high. What people are not necessarily aware of is that the cost to hospitals for prescription drugs are also very, very high. There are some estimates that a hospital budget in Vermont for UVM is 20% of their entire budget just on prescription drugs. Now, we're making some progress in Washington in trying to take on the greed of the pharmaceutical industry and lower the cost of prescription drugs. But here in Vermont, we've got to do a lot better job as part of that effort. Lastly, there is a culture, I think, that we've got to change. And what we have got to make clear, and I would certainly hope that in Vermont we lead the nation in this respect, is, yeah, we understand the greed of the drug companies and the greed of the insurance companies. I had a guy before my committee in Washington, pharmaceutical executive, made $50 million a year, all right? And right here in the state of Vermont, you have hospital executives who are making almost 10 times more than what the governor of the state of Vermont makes. And that sends a message to the whole system. If you want to make money out of healthcare, work for the drug companies, work for the insurance companies, and rip off the American people. But if you believe that healthcare is a human right and we're trying to lower the cost so that everybody in our state can have quality care, you don't need to make 10 times more than what the governor of the state of Vermont makes. And it's not just one individual. There is a whole lot of administrative expense that I think we can cut. So it's not only saving money, it's a culture that says we want people in the state of Vermont who are going to work day and night to lower the cost of health care, provide health care to all of our people. It's a different culture. So with that, let me introduce Ginny Lyons, the chair of the Senate Health Committee. Ginny?
Thank you. Senator. I can't thank Senator Sanders enough for shining a light on some of the solutions that we are doing in Vermont to correct the healthcare crisis. We all now finally recognize we're in a healthcare crisis. Your Senate and House are passing legislation that will open the black box for healthcare transformation to lower unsustainable insurance costs, unsustainable hospital costs, and that threaten our entire healthcare system. We're providing our Green Mountain Care Board regulatory body with the authority to reduce hospital costs through reference-based pricing and global budgeting. And believe me, it's not difficult to understand our healthcare system, and it's time that we educate our public and our constituents about the costs that are embedded in the black box of healthcare. We're saving our Blue Cross and Blue Shield domestic insurer from insolvency. We're stabilizing access to primary care, family medicine, our federally qualified health centers, our very important community health centers that are so critical for all of us for prevention services, our long-term care. We're helping our independent providers. We're stabilizing our financially fragile hospitals, so many of whom need the support that we can give them as they go through transformation to new care facilities. We're building a community health action plan that links community needs with healthcare responses. We're providing clinical information that's timely for patients, providers, and payers. Why are we doing this? Why are we reducing patient premiums for healthcare? So that patients and small businesses can afford to stay in Vermont. We know that 1% increase in healthcare prices results in a 0.2% reduction in income, a 1% loss of jobs in our economy, and overall, that increase in healthcare costs does not result in better outcomes of care. We are now working to allow people to access food, rent, and healthcare without having to make choices for one over the other. We've put in place S-126. We are putting in place S-126. We are putting in place H-482 and other portions of our budget to reduce the cost of care in Vermont. Right now, our budget in the state of Vermont reflects 20% of our budget is health care. So I want to say thank you again to Senator Sanders. It's time that we focus on solutions. It is past time to focus on solutions, not simply the crisis. Thank you.
Thank you, Ginny. Thank you very much, Senator Lyons. Now, Representative Alyssa Black is the chair of the House Committee on Health Care. Alyssa?
Thank you. And thank you, Senator Sanders, for the opportunity to speak about this really critical issue and the systemic healthcare challenges that we're facing in Vermont. We are in a perilous situation right now. We have issues with affordability, quality, and access to not only acute, specialty, long-term care, but even access to the most basic and essential primary care. We are at a tipping point, and we can no longer delay action to address this crisis. This will take everyone working together to transform our delivery of care and to reallocate the scarce resources that we have to ensure that we have a healthcare system that really works for all Vermonters. I know that myself and Senator Lyons have taken this responsibility this year head on. In this legislative session, we have both worked tirelessly on bills that address the emergent crisis we're in, such as H-482, which addresses the insolvency of Blue Cross Blue Shield of Vermont. And we are also looking at bills and working on bills that address both short-term, medium-term, and also long-term, namely S-126, which imagines a transformation of our healthcare system, how we pay for healthcare, and how we allocate our scarce resources. This has not been easy, and I will tell you that both of us have received an awful lot of pushback. But it is really essential and crucial. And I keep saying there is not going to be a perfect solution, and there will be consequences, and some will not like it. It won't be pretty, but we know that the consequences of inaction will be catastrophic. And I'm really actually happy to see so many people here today, including Senator Sanders, who are taking this seriously. And I know that if everyone works together, that this is something that we can come out of. And thank you again, Senator Sanders.
Thank you. Thank you, Representative. Owen Forster is the chair of the Green Mountain Care Board. Owen?
Thank you, Senator Sanders, and thank you to our legislative leaders, Chair Black and Chair Lyons, for their leadership this legislative session. Vermont has some of the highest health insurance costs in the nation. They're rising by double digits every single year. Vermonters and our businesses cannot sustain these rising health care costs, which harm demographics, stagnate economic growth, and impact our families and our health. It's unacceptable, and we're either going to change this course together in a planned, intentional way, or market forces will do it to us, and we will not like the outcome. The challenges are immense, they are real, and they need to be tackled now. The Green Mountain Care Board has called upon leaders in the healthcare industry to deliver on the promise of provider-led reform. We've asked providers to come together and immediately reduce commercial spending by around $200 million and protect essential services so that we do not harm Vermonters or their pocketbook. I also strongly support the legislation that's been introduced by Chairs Black and Lyons, including a cap on hospital-administered drug prices. Vermont hospitals have the highest upcharge in the United States of America on outpatient drugs. Vermonters with debilitating conditions such as Crohn's disease, arthritis, or even cancer not only suffer physically, but then financially. The cost of Neulasta, a cancer drug that's critical to treating patients on chemotherapy, has an average cost of $1,300 a year. In Vermont, patients may pay tens of thousands of dollars to receive that exact same drug. At the same time, our primary care providers and our FQHCs can barely financially survive. It's backwards and it's wrong. It needs to change. I also support S126, the accountability for immediate system-wide transformation and long-term approaches to addressing healthcare costs, and the emergency authorities in 482. We are at an inflection point, there is no question, and Vermonters expect its healthcare leaders to band together, set aside self-interest, and create a healthcare system that works for the people. Thank you.
Thank you, Ron. Lisa Ventris is co-chair of Vermont Healthcare 911 and former president of Vermont Business Roundtable. Lisa?
Thank you, Senator Sanders. In a time of deep political division, VHC 911 is dedicated to maintaining a nonpartisan, broad coalition of business and labor leaders, healthcare providers, nonprofit leaders, educators, policymakers, and political leaders, united to demand relief in healthcare costs and to achieve an affordable and sustainable healthcare system. Today, Vermonters find ourselves in a full-blown healthcare crisis of affordability that demands urgent action by all stakeholders. Vermont citizens are paying extraordinarily high rates for commercial insurance, the highest in the country, and more than double the national average. Since 2018, health insurance premiums in Vermont have grown a gobsmacking 92%, compared to the national average of 12%. And Vermont hospitals account for 44% of total healthcare spending. Recently, Blue Cross Blue Shield of Vermont filed a rate increase with the Green Mountain Care Board and asked for a 13.7% increase for the small group market and 23.3% for individuals. This request, on top of prior double-digit rate increases, is unsustainable, and Vermonters can't afford to wait any longer for rate relief. Our coalition members show that the cost of Vermont's health insurance premiums is hurting job growth and slowing our economy. They must either forego new full-time hires in order to afford rising premiums for their incumbent workforce, or hire part-time workers and provide no health benefits. We have seen that rising health insurance premiums drive up school and town budgets and further impact Vermont's affordability and desirability as a place to live, work, and raise a family. And high costs contribute to the increasing number of Vermonters who are uninsured or underinsured. To be clear, VHC 911 believes that our hospitals are a vital part of a strong healthcare system, and we know that our hospitals have incredibly talented and dedicated people delivering care. At the same time, we also believe that hospitals must run efficiently so that most healthcare spending is focused on patient care, not on administration and management. VHC 911's analysis of nationally available data demonstrates ample room for savings in Vermont hospital budgets without reducing patient care. We challenge hospital leaders, the Green Mountain Care Board, the legislature, and the administration to further accelerate their efforts with the urgency that is required to identify opportunities and rein in healthcare costs in Vermont that move us closer to the national average. Please look for our data at vhc911.org. Thank you.
Lisa, thank you very much. Mike Fisher is the Chief Healthcare Advocate for Vermont Legal Aid. Mike?
Thank you, Bernie, and thank you everyone standing behind me, and thank you for paying some attention to this. I run the Healthcare Advocates Office, and we run a helpline where Vermonters call us every day trying to figure out how to get through the maze of our healthcare system. Often they call us in some of the worst days of their lives. They've received a bad diagnosis, or their loved one has received a really difficult diagnosis, and not only are they afraid, but they don't know how they're going to pay for it. Over the last couple of years, we've allowed hospitals to raise their prices unchecked. The result of that is, as has been mentioned before, the result of that is that we have some of the most expensive prices in the country. That the result, how that plays out in people's lives is disastrous. How it plays out in small businesses' lives is disastrous. So I'm in full support of the efforts that have been made in the legislature this year. I'm in full support of collaborative efforts to bring hospital leaders together to do their part to voluntarily reduce prices. And I think it's time that we set prices and make sure that our regulator has the power to actually reduce the prices so we don't drive this system off the cliff, so we don't result in a broad bankruptcy of our healthcare system. Thank you.
Thanks very much. Jacob Berkowitz is the president of UVM Medical Center Support Staff United.
Thank you, Bernie. So I'm Jacob Berkowitz, president of Support Staff United at UVM. I'm also on the board of AFT Vermont, which represents around 7,000 healthcare workers, including nurses, providers, techs, and support staff. As a union leader and staffing specialist in inpatient nursing, it is clear to me that the healthcare system in this country, and especially in Vermont, is collapsing. Key aspects of Vermont's healthcare infrastructure are at risk of closure or have already closed just this year. The CVMC inpatient psych facility closed in January. The birthing center at Copley is under significant risk of closure, and the Planned Parenthood in St. Johnsbury will close on June 3rd. Both key access points in reproductive health in Vermont. Primary care clinics across the state are being consolidated, which means longer wait and travel times for patients. UVMC, my employer, has been capping its daily census, putting more pressure on the emergency department as patients are stuck waiting for beds. And in a couple of weeks, the genomics lab at the hospital is closing, which means much of the genetic testing for cancer patients may take longer as more samples will be processed out of state. On top of these impacts, I need to highlight the cost of this calamity on my colleagues. Violence against healthcare workers is rampant. Burnout is real as many leave the bedside or the industry entirely. The loss of experienced and talented staff has incalculable effects on the quality of care we can provide. As the federal government exacerbates these issues, it is up to us to fight for our fundamental right to health care. It's not fair that anyone is asking it of us, but it is necessary. It wasn't fair that it took extremely short staffing in the aftermath of COVID to make my coworkers see their value. It wasn't fair for support staff, including many refugees, to fear retaliation when they signed their membership cards. And it isn't fair that even with a strong contract, many of our members still struggle to pay the rent or even owe medical debt to our employer. Despite the lack of fairness, my union increased wages averaging 32% at the largest employer in the state. We achieved job security that ensures UVMMC can't outsource our work and that our members have options when facilities close. There are other successes, but you don't need to be in a union to improve things. I know the struggle feels impossible, but if we organize, be it neighbors, friends, peers, or coworkers, we can hold the medical industrial complex accountable. It's harder for them to say no when crowds of angry people demand better. With respect to the experienced leaders here, especially Bernie, who activated my passion in healthcare and labor 10 years ago, it is ultimately we, the people, who have the power to improve things. Thank you.
Good job. Okay, thank you all. Questions?
Senator,
Yeah.
Small business, Tim at Vermont tonight. Small business owners, maybe even big business owners, love to get out from under health insurance. Why hasn't small business especially coalesced around Medicare for all or
Tim, that is a great question. Look, at the end of the day, what you've heard from every speaker here, the current system is absolutely broken. It's especially broken in Vermont. It's broken all over the country. The reason that we are the only major country on earth not to guarantee health care to all people as a human right, The reason we are spending twice as much per capita on health care as the people of other countries has everything to do with the broken campaign finance system, the power of the insurance companies, and the power of the drug companies. All right, when you see 30-second ads on television blasting people who are trying to provide health care to all, you know what the system is about. But as Jacob just indicated, all over this country, people and small businesses. How do you run a small business if your health insurance costs are going to go up 15 or 20%? You can't. And people all over Vermont and all over the country know that. Long term, obviously, in my view, speak only for myself, we need a Medicare for all single-payer system. But what we're doing today is trying at least to develop a sense of urgency in the state of Vermont. The status quo cannot continue. It is failing. It's failing small business. It's failing patients. It's failing every Vermonter. Other questions? Yes, ma'am. We are leading literally, as the ranking member of the Health Committee, I'm doing everything I can to defeat this disastrous Republican bill, which would cut Medicaid and the Affordable Care Act by some $715 billion, maybe more than that. We'll see what evolves. The result of that is between 8 and 13 million Americans will lose their health insurance. Hospitals, nursing homes, community health centers, which are dependent on Medicaid, will be hard hit as well, and the costs will be shifted elsewhere. So what we are trying to do right now is everything that we possibly can in every possible way to defeat this awful piece of legislation. And by the way, let's be clear, no great secret here. The reason that Republicans are cutting health care by $715 billion is in order to give tax breaks to the very wealthiest people in this country. This is the Robin Hood proposal in reverse. You take from the poor and you give to the very rich. This is a disastrous piece of legislation. We've got to defeat it. Yes.
Stephen, this might be better for Senator Lyons or Representative Black. I'm sure you guys are somewhat paying attention. Last week, Governor Phil Scott at his press conference said you can only deal with so many crises at one time, pointing towards housing, pointing towards education. Sense of urgency has really been elaborated on this case. I guess if there's nothing with the session, obviously, somewhat trickling down too, if there's not going to be any drastic overall health care this year, are we going to see rates across the children increasing again next year? How quickly will we be able to get something done next year?
So what we're looking at is the governor signing the bills that we've passed. We've passed a medical debt bill. We've passed a violence in workplace bill. We're passing S-126, which looks at somewhat longer-term transition, which would begin probably in 26, not that far away, and 482, which looks at reducing, saving Blue Cross and Blue Shield and reducing premiums overall in both bills. The crisis affects education. The crisis affects the ability to buy a house. The crisis affects the ability to buy food. So saying that we don't need to deal with this crisis now says we don't need to deal with the educational property taxes, or we don't need to deal with housing for folks. So we don't need to deal with the effect on small businesses that we're hearing about. The healthcare crisis is fundamental to all the other crises we face.
Okay, I've got a plane to catch. Any other questions?
So at the root of these problems, as we were at the root of these problems, which we were told by Oliver Wyman, consulting on Act 67, is that housing, a lack of housing and demographics are really what are causing these problems. How do we fix this statewide? How do we fix this federally so that Vermont can withstand it?
Well, I'll speak nationally. These guys can speak from the Vermont perspective. Nationally, we've got to radically reorient our priorities. Never forget that we are the richest country in the history of the world. It's not like we're a poor country, but we have more income and wealth inequality in America than we've ever had in our history. One guy owns more wealth than the bottom 52% of American households. And yet, right now, Republicans want to give massive tax breaks to the very richest people in this country. We're spending $1 trillion a year on the military. This budget, healthcare crisis in Vermont, all over America, $150 billion more on the military when we already spend more than the next 9 countries combined. So what we have to do as a nation is get our priorities right. And one of the priorities is join every other major country on earth, guarantee health care to all people as a human right. Do not have a healthcare system whose major function is to provide massive profits for the insurance industry and the drug companies. That's what we got to do at the national level. Sure.
Very, very briefly, you brought up the Oliver Wyman report. Oliver Wyman report does say housing is important to our healthcare environment. Oliver Wyman also said that transportation is key in getting people where they need to be, either emergency or non-emergency. Oliver Wyman also identified every single aspect of what is currently in the bills that the Senate and the House are working on together. So we can do more than one thing at the same time, and I think it's critical that we do that. Otherwise, everything will implode.
All right, listen, thank you all. I mean, I think we're all in agreement that we have a major crisis here. Thank you all very much for your interest. See you soon. Okay, guys, thank you very much.
Thank you, Senator.